Good morning, Rockland. Mark Brownstein here from Emerald Medicare. Such a pleasure to be here. This is not my normal slot, but because it is October 15th, I am on the air talking about open enrollment in Medicare. It is a crazy time of the year, and I have as my guest my valued assistant, Michele Horton. Welcome, Michele.
Hi, Mark. Good morning, everyone.
Good morning. So many of you have worked with us. It has been wonderful for over 2 years to be a part of WRCR. I've recently heard, I was at the Alzheimer's Association walk with Michele last week, and people came up to me and have heard me on the radio and have referred business to us. And so we're really grateful for that. We work hard every day, don't we, Michele?
We certainly do.
We do. So, again, you're local to this community up here in North Rockland.
I am.
Before we get into some details about Emerald Medicare and the work that we do all year long, just a little bit about your family and your passion about this community.
I've been a North Rockland resident for 6 years, starting in December. I have two beautiful children, Isabel, who goes to Fieldstone Middle School, and my son Brian is in Farley Elementary. My husband is a longtime mechanic in Suffern. He's out of business there for over 25 years. And I love it here. I absolutely love it here in North Rockland.
It's a great town, and we have our office at Liberty Square Mall, and so we do get people walking in there and asking us questions and setting up appointments. And so, again, Mark Brownstein with Michele Horton at Emerald Medicare. Our website is emeraldmedicare.com. Our phone number is 358-1220. Michele, this is a time of the year when the pace has picked up a bit. And we're helping a lot of people. So what have you seen over at least just the last 2 weeks that has sort of changed the way in which we operate?
Well, we certainly have put out a lot of information to our clients. We've sent out emails. We've mailed things in the mail to them. The calls have increased significantly, and so have the emails. But it's mostly people just checking in to make sure that what we made for them is what they should still have for 2022.
So there are changes, and one of the things that it's really important for people on the air to know is that if you have Medicare, you are getting something in the mail called an annual notice of change. You may or may not be reading it, but it is in fact the specific changes that are going on within your plan that you have with Medicare. And it's important to read it, but it's also important for people to reach out to us so that we can explain the differences. One of the big areas that you and the rest of our team, and Carrie, I know you're listening, and Carrie is a part of our team, also helping to look at the doctors and the medications. And that's a big part of the work that you do to help so many people all year long. Maybe you can explain to our listeners how important that is and what it is that you do in that regard.
Basically, it's a lot of work. It's a lot of research through Medicare.gov. We look at all your medications. We look at your dosage, your frequency. Is there a generic available? Is it only brand name that you take? If you're on a brand name drug and it's expensive, we look for other options for you as far as using a coupon or a grant from the pharmaceutical companies. We try to do as much as we can so it makes it much easier for you to get the medications that you need. Every year during this time, as we all know, everything kind of changes for 2022. So we make sure that the drugs that you're taking, the plan that you're on, is still basically the best bang for your buck. We try to save you as much money as we possibly can throughout the year.
And we love helping our clients.
I love our clients.
We do.
I love all of them.
So I've called it bait and switch. And so there are some carriers out there on the prescription drug side who have surprised us. And this isn't the first year that they've done this. And so I think this is of some interest to the listeners. And what do I mean by bait and switch?
Well, it's a fun term to use around the office for sure. It's when you're on a plan and then they increase your premium significantly, and then they don't give you the best coverage for the drugs that you're taking. And if you don't read that lovely letter that comes from your carrier in the mail, you may not know that come January, your premium has almost quadrupled, and you might have to pay more out of pocket for the drugs that you're taking. So we try to help our clients. We know which ones are going to be changing, and we contact them, and they have been so incredibly thankful because they didn't pay attention to their mail because there's so much mail coming in right now.
So the carriers that I can mention, which I think is important because people are listening and people have Part D plans. So again, just as an informational piece, if you have a Med Advantage plan, your prescription drug plan is included, and you really don't have choice year to year. But if you have a standalone prescription drug plan because you have a supplemental plan, often called Medigap, that's where the extra effort on our part is. And so the carriers that have done this adjustment is Elixir, WellCare on their Wellness RX plan, and then is there a third carrier?
No, those are the two biggest.
Those are the two big carrier changes in pricing. So if anyone out there has either of those two carriers or specifically the WellCare Wellness Plan, please reach out to us. Again, the prescription drug side is so important because there are 4 stages of costs. And we explain to the people on the phone how they go from a deductible to the after the deductible to what's called the coverage gap to catastrophic. And that's a big part of how you spend your time explaining these, don't you?
I do. It's very confusing.
Right.
And I'm thankful that we have the information and the resources that we do to help our clients with these difficult subjects, because not everyone understands their medications or how the pricing affects them throughout the year, why they're paying a certain amount right now, but maybe a couple months from now they're going to have to pay quite a bit more, and they're not prepared for that.
Absolutely. So, the statistics around Part D plans are, in a way, surprising, but it's important to know, is that there's a deductible, right, for medications that are considered brand, or in our world, it's Tier 3 or above. The deductible does not apply for generic medications. And so people are concerned about that, but generic medications, that deductible doesn't apply, but the deductible has gone up. The deductible for 2021 is $445. The deductible for 2022 is $480. That's a 7.5% increase. That's significant. And overall, Part D plans have increased in price. And your total cost is likely to go up. And so it's important to be efficient about it and to really pay attention to it. Epic. Epic is something I talk about in every phone call, but also on every radio show, because Epic is a New York State pharmaceutical program that is really for the purposes of people who are over 65 and people who are looking to make a change in their plan mid-year. But Epic is a plan where if you meet the Epic's deductible, no medication that's Medicare approved can be greater than $20. We don't make a nickel on Epic. We help send the Epic application through Michele's effort in faxing it to the New York State. And we help people get these programs in place so that they can save additional money on their prescription drugs. People are incredibly grateful for the work that we do, and we're proud of that. So, dental and vision, Michele, that's something that we often face in terms of people's expectations. What do you see occurring in the dental and vision space from what you know?
Well, the Medicare Advantage plans have definitely upped their game for next year. They're offering a bit more in their dental riders and included in their plans. And the private plans, I don't know too much about that, but I know that it is in very high demand right now. Dental and vision are asked about more on our phone calls and on our emails and in your meetings, more so now in the last 2 years than I've ever seen before.
And it's really in the national news as well. It's there's an expectation, I think, that dental and vision will come to these plans. Certainly not for 2022, but maybe for 2023. Will it cover more than just cleanings and x-rays? I don't know, but I can tell you that the demand is high and the need for good dental care is very strong. So there's a couple of events that I've done lately I just wanted to mention. I had the honor of presenting in front of the Rockland Nursing Association. Michele was there supporting me. We had 40 nurses at Bolzano's on 9W, and I educated all these nurses, and they were thrilled to have this kind of knowledge and information. Some of them for their clients, some of them for themselves personally. I was at the Palisades Mall for the mall walkers, so I met some wonderful people who walked the mall, and again, I was there speaking of the services that I do. I am in Rotary. I'm involved with Bridges. I've helped educate veterans. I was recently at the Post near Boulder Stadium talking in front of 35 veterans. And it was just wonderful to have the opportunity to speak to the veterans and just educate them on the need for especially Vietnam veterans to get Part B. Because without Part B, they really don't have this extra choice, the extra choice beyond just their VA benefits. And for some people, driving to the veterans organizations are, for health care is difficult. And so it's nice to have a backup. So we deal with a lot of carriers, don't we, Michele?
We sure do.
And why do we deal with so many carriers?
Because we like to have everybody to have the best choice for them, for their health, for their budget, for their needs, for everything, just to make sure that they have the best coverage they could possibly get.
So I'd asked you earlier about the doctors and the meds, and you explained about the meds, but what is it that you and your team do around the doctors to make sure the clients do get the best coverage?
So, as you know, Joe Namath is all over the TV. There's a lot of information. Please come to us. We offer all these wonderful programs, no premiums, no anything, and they're wonderful plans, but we find that people call for these plans and sign up, but none of their doctors are in the carrier's panel. So when they go to see their doctors, it's all out of network, and they don't understand why my visit wasn't covered or why am I paying so much money for this. So what we do is we take a list of all your doctors, and we go through each carrier that we represent, and we see if they're in network. So when you choose a plan, you're choosing a plan that is best for you, that has all or most of your doctors covered. So there's very minimal out of pocket for you and good coverage.
From my perspective, Michele, and I know you know this, is that is really the most important part of our job, because people can change their plans, and of course this is the time of the year when they have the option without any questions asked. But if their doctors are in the network, most people are not necessarily willing to change doctors. Some people are. I am I am the only sole independent resource for Highland Medical and for Nyack Montefiore. I'm very proud of that. I've been doing it for 4 years. We get a tremendous number of referrals from those offices. But those are some of the doctors for some of the patients. People go outside of Highland Medical. They want to know that they are covered for all of the doctors, all of the facilities they go to. Can they travel around the country? Some of the larger carriers, you can travel, but you need to check. You always need to check to make sure that a doctor is in South Carolina or Florida, and we'll do that work as well. So it's the doctors and the meds I emphasize on this radio show today is a big part of why you may reach out to us. Because if your doctors and your meds and your coverage is all fine, we will, of course, encourage you to stay the course. But if there's opportunities for better coverage, one of the things that's been on the air lately is this Part B payback. And that payback could be $35, maybe $50. The advertisements are misleading in that you can get the entire Part B, which is currently $148.50, paid back. Well, not in New York. Maybe in other states, but not in New York. So my core business is really Rockland County, but it is New York, New Jersey, Connecticut. So again, Mark Brownstein, Emerald Medicare, 358-1220, here with Michele Horton, my valued assistant for, I believe, 3 years. So how is it working at Emerald Medicare?
I love working at Emerald Medicare.
How come?
I love coming in every day. We have fun, we laugh, we help people. I think the best part about the job is helping people who really need the help. They really are lost when they come to you, and you really help them, guide them in the right direction, which is nice. And our services, I can say from the bottom of my heart, are honestly 100% free.
Thank you.
100%.
Thank you for mentioning that, and people are surprised by that, but it's true because I cannot charge for a service, and for me, it's really about helping people. But eventually, if I am able to help people with a plan, I get paid by the insurance company. If not, I just encourage people to tell a friend, and many people on the air here have told friends. And I'm grateful for that. You know, we work hard. There's a lot of confusion. There's a lot of mail. There's a lot of TV ads, especially starting October 1st, but it's going to be nonstop from now until December 7th. So I think you would agree with me, Michele. We would like people not to wait till December 7th.
Please don't wait until December 7th. At least call us by mid-November if
Right.
you're considering a change. So we have enough time to put everything together for you and do the proper research that you deserve.
Right. So I am doing a webinar, a few webinars, Michele, that you've helped me coordinate with, which is the church that I am doing the presentation for.
There is a lovely church in, I believe, West Nyack. I'm not 100% sure,
Okay.
but it's for a lovely group of seniors there that need your help and have probably never heard of you before.
Right. And then Stony Point Library, I am doing next Monday at 6:30 p.m.
That's a webinar.
That's a
So
webinar.
anyone can come and join us.
That's correct. You can contact the Stony Point Library, and I will be not on the air, but on the webinar air, and I'll educate you. I'm also doing a open enrollment webinar through my company. So we have two going on. And so, again, if you have any questions at all and want to be on the webinar, educating people about the specifics of some of the plans that are being offered, please call our office. Again, 358-1220. You know, we are energized this time of the year. We are looking forward to helping a lot of people. But I have to say, please be patient with us. Right?
Yes, please.
Right. We want to get back to people as quickly as we can, but it is a challenging time of the year. So I just wanted to mention, Michele, we have a out-of-town employee.
We do.
Right.
We do. He used to be in town, but
Right.
now he's out of town. And he's very far away.
Where is he?
He's in Louisiana, in
He
New
is.
Orleans.
Yes, he's going to graduate school there. He again loves working with us, and so we've kept him on board. He's working in between his class schedule, and incredibly valuable. He's actually been on the air with me. He was the gentleman who actually sang a song on the air. So he's very talented. He's actually going down to New Orleans to continue his acting career. So we're grateful that he's stuck with us, and vice versa. So it's been fun. I mean, you've worked with me for, I don't know, 3 years now.
Yep, 3 years.
Yeah, you've learned a lot.
I've learned a lot.
Right.
A lot.
And-
And I still learn something new, honestly, every day. Every day.
I do
Even over
too.
breakfast. We had breakfast at Sparky's before our radio show today, and I learned about the Part B payback. I didn't know what that was, and Mark took his time and explained it to me.
So yes, we always go to Sparky. It is my tradition to buy lunch for all my guests at Sparky's every time I do a radio show. So it is a pleasure to service this community. It's a pleasure to be involved in this marketplace where we feel gratitude every day, don't we, Michele?
We do. We do. It's nice to give back to people who are so incredibly thankful and appreciative of the work that we do. I mean, I can say I've been with you for 3 years. I know that you care about every single person that's in our client base and all the prospects that call. You spend your time with them, you talk to them, you listen to their stories. We have a lot of heart at our job.
Yeah, it's about compassion. And, you know, my open enrollment webinars, one is October 26th at 11 a.m., and the other one is November 9th at 6 p.m. But please call and reserve a spot so we can send you the Zoom link. Soon, I hope that I am live again and offering, a face-to-face opportunity to listen to me. I miss it terribly, but, you know, it is a chance to still educate people. I educate probably 1,000 people a year. We bring on about 200 new clients a year, and it's a busy time, and so we're grateful for it. All I know is that this is the career that I have enjoyed the most. I've been in senior type services for 25 years. As an elder advocate, I helped with long-term care. I've done a lot of things in this area. I get the most satisfaction, and people are the most grateful. And so that's really great. We've been increasing our Google reviews. We've been doing everything we can to get ourselves out in the marketplace. But one of the expertise that you have, Michele, is around billing. You come from a medical billing background, and people often get confused. So very lightly and quickly, can you just sort of mention what some of the questions and confusions come up when it comes to some of the billing issues?
Sure. A lot of the questions come around their annual deductible every year. They don't understand why they're getting billed from an eye doctor or a cardiologist, why I've never gotten billed from this doctor before. When you have a Medicare and a Medigap plan, you have to meet your annual deductible. Doesn't matter which doctor you see in the beginning of the year, that's who you're going to get your bill from. I get a lot of questions, why am I getting billed for out-of-network? What is a co-insurance? What is a copay? How come I'm paying so many copays? Sometimes there are situations where when you're new to Medicare and CMS hasn't been updated yet, and all your bills get rejected, and people think that they have to pay these $1,000 of bills that come in the mail. And it's just a matter of calling the Social Security office or Medicare and just saying, hey, now Medicare is my primary. I don't have that plan anymore. And everything cycles through, and people are so thankful because they don't understand. There's also in New York State, there's no surprise bill. That's a new law that was passed last year. So if you're at a hospital and they're sending you thousands of dollars of bills that you weren't expecting, you do have some ways to work through. Yeah, and appealing. Most people don't understand appeals, and it's very confusing, but I'm there to help.
So we help advocate. The client often needs to advocate for themselves. We'll try to intervene with the insurance company if we can. Michele, you've been so valuable to me, and you know that, and I'm grateful for the services that you put in and the time that you have amongst your very busy home life with your wonderful kids and husband. So one other thing is that the Social Security office has been closed.
Yeah. Oh, yes.
And so we've been helping hundreds of people, and what have we helped them with?
Just getting their paperwork there.
Right.
We had a lovely local lady come in this week in a frenzy. She couldn't get her forms to the Social Security office, and I said, well, we can fax them. And she says, you can? And I said, yes. So she came to the office, and we sent her papers in, and she was so incredibly thankful. So we help people pretty much with every aspect from beginning to end. And after it's over, we're still with you also. We don't go away.
Right. We have loyal clients. I have loyal listeners on the air. We help people with Medicare and the combination of Medicare and Medicaid. Again, our involvement in the community means a lot to me. There's so much need out there, but we have our little niche in Stony Point and in Nyack. Drop by our Stony Point office in Liberty Square Mall. Come say hello. Call 358-1220. I'm in and out. Michele is mostly in, but in these days of COVID, sometimes she does work from home as well. So again, October 15th is the first date in which you can actually sign up for a new plan. December 7th is the end date, but these plans would be effective January 1st. I want to thank you, Michele, for coming on the air again with me.
It's always fun coming on the air with you.
Yes. And again, thank you for all the listeners. You have any questions at all, check out our website, sign up for the webinar. Let us help you understand the plans that you have, the choices that you have, so that you're confident in the coverage. Nothing's free. Don't buy into all of the hype, but make sure you speak to somebody who's independent, local, and passionate about the work that we all do. So thank you, Michele, and thank you all, WRCR listeners, and have a nice weekend.